My name is Dr. Wadsworth. I'm a psychiatrist, and I'm making this video as a message to other psychiatrists. So there is a subset of patients that we have with conditions like schizophrenia and bipolar disorder who may need medications for the rest of their life. The majority of our patients are depression and anxiety patients. Of these patients, there are a lot of things that can contribute to their depression and anxiety. Trauma and medical conditions and hormonal conditions and thyroid disorders. If a person is able to change their mood through changing their thoughts and changing their behaviors, you might assume that their mood is determined by their thoughts and behaviors. With my patients, I started to evaluate different aspects of their life and try to figure out if there were different things that could be contributing to their depression and anxiety, and then try to find ways of assessing this. I then began giving my patients specific advice about certain things that they could change in their life or techniques that they could use that could change these aspects of the life of things that might be limiting their happiness or causing them depression and anxiety. I have incorporated these techniques into my psychiatry visits. I don't always have time for it, and it's not always appropriate to do it, but very often it is. I've attempted to summarize everything that I do with my psychiatry patients outside of medication into one book. This is the book that I have summarized these ideas and practices in. It is a collection of things I've gotten from cognitive behavioral therapy and all kinds of different books that I have read on the subject of psychology, as well as a number of my own ideas. Since I started implementing the ideas in this book into my practice as a psychiatrist, I have started having a lot more success. For example, today, I actually had 3 patients, quote-unquote, graduate from psychiatry. What this means is that they're doing so much better that they no longer needed medication, and they're only going to contact me if they need me again. And that's something that just didn't happen before.